start with the actual pathology. Okay, so first we will talk about pathology of nasal cavity. So first we will discuss about congenital abnormalities. The first one is choanal atresia. The first abnormality is choanal atresia. So here you can see choanal atresia. What is the meaning of atresia? Atresia means something is actually not present, right? Something is actually not present. In that case, we will use the word atresia, or when they are present in they are actually not properly formed. So here what happened? What do you mean by choanal atresia? Choanal atresia means failure of formation of one or both the communications between the nasal cavity and nasopharynx, right? Failure of formation of a communications between the nasal cavity and nasopharynx. In simple words, what happened? Air cannot travel from this if you take this is entry point of the nasal cavity, then what happened? They cannot travel from this point to nasopharynx or up to the larynx, right? Because some portions are actually not properly formed, so this entire canal is actually not properly formed. In that case, we have to use the word choanal atresia. This choanal atresia is quite common in llamas and alpacas. Here you can see this is another good example, right? Can anyone say what are the abnormalities in this case? This is actually nasal cavity. You can see this is mouth, and here there should be some nostrils. Okay, but here what happened? Nostrils are not present. This entire nostrils are covered with the skin. Okay, so nostrils are not present. It means what happened? Air cannot enter from this particular place, right? So this is known as choanal atresia. Many times what happen? This particularly nasal cavity will not form. They are actually, there will be no space available for air travel, right? So they are known as choanal atresia. These are quite common in camelid family. Okay, now circulatory disturbance. Sorry. Now circulatory disturbance. First, we'll talk about epistaxis. Epistaxis means bleeding from nostrils. Bleeding from nostrils. They are known as epistaxis. So hemorrhage from the nose can be unilateral or can be bilateral, right? Unilateral means from one nostrils, bilateral means from the both the nostrils, right? If blood is come out from the nostrils, they are known as epistaxis. So generally unilateral epistaxis are can be seen in any trauma, right? If there is any injury occurs that to that particular nostrils, then epistaxis will occur, there will be hemorrhage. In case of severe inflammations also, there will be epistaxis. In case of guttal pouch are present in case of equine. So whenever there is infections or inflammation of a guttal pouch, in that case, you will find unilateral epistaxis. Whenever there is a problem in the tooth, in that case also, if there is suppose abscess or any neoplasm, in that case, it will actually affect the nasal cavity, and then you will find unilateral epistaxis. In case of our indigenous cattle, if we talk about Kankrej animals or Gir animals, in that case also what happened? Suppose there is a cancer of a horn, most commonly squamous cell carcinoma. In that case also you will find unilateral epistaxis. Bilateral epistaxis can be again seen in any type of trauma, any type of inflammations, abscess or neoplasms, as well as this bilateral epistaxis can also occur when the number of platelets counts are decreased, right? So whenever there is a thrombocytopenia, this thrombocytopenia is responsible for epistaxis. In particularly our crossbred animals, many a time hemoproteasal disease like thalidosis, babesiosis, they are responsible for severe thrombocytopenia. In that case, you will find bilateral epistaxis. Sometimes pulmonary hemorrhage are also responsible for bilateral epistaxis. The hemorrhage which is occur inside the lungs, inside the trachea, it will actually regurgitate into the nasal cavity, and you will find epistaxis. Now inflammation. So first we'll talk about inflammation of nasal cavity. So inflammation of nasal cavity is known as rhinitis. Rhinitis means inflammation of nasal mucosa, right? So depending upon the nature of exudate, This rhinitis can be classified into 5 subtypes: serous rhinitis, catarrhal rhinitis, purulent rhinitis, fibrinous rhinitis, as well as granulomatous rhinitis. Okay, so let's discuss one by one. First one, serous rhinitis. Serous means when exudate is clear fluid. When exudate is clear fluid, in that case, we will use the word serous rhinitis, right? So serous rhinitis is actually mildest form of inflammation, and this is actually characterized by hyperemia. Hyperemia means increased blood circulation into the nasal mucosa, and whenever there is inflammation, ultimately what happens, vascular permeability will be increased, so ultimately there will be exudation of the plasma, and this plasma will be actually due to exudation of plasma as well as due to the inflammation, ultimately there will be production of a clear fluid, and this is known as serous rhinitis. The serous rhinitis is most commonly seen in common cold in humans. Okay, then second one is catarrhal rhinitis. Catarrhal rhinitis means here what happen, this is actually comparatively the pathogens or etiology is comparatively more severe than serous rhinitis. Okay, and here what happen, catarrhal means presence of mucus. Okay, so here what happen, due to any infection, due to any type of inflammation, number of goblet cells will be increased, and ultimately these goblet cells will release the mucus, and due to this reason you will find typical mucus exudate. Okay, so when mucus exudate is present, then we will use the word catarrhal rhinitis. Okay, the third one is purulent or suppurative rhinitis. So purulent or suppurative rhinitis is actually again seen whenever there is a infiltration of neutrophils. Okay, so here what happens, whenever there is any infection or inflammation, neutrophil will be enter into the tissue. It will release the lytic enzymes and ultimately to kill that particular organism. So ultimately what happens, that organism may be killed as well as surrounding tissue will also get dies, and all they get mixed together, it will form the exudate, particularly suppurative exudate or purulent exudate. Then fibrinous rhinitis. So in fibrinous rhinitis what happens, particularly the pathogens are comparatively more severe. It will directly affect the vascular endothelial cells, right? And due to the severe infection, severe inflammation, vascular endothelial cells actually get affected. Vascular permeability will be increased, and ultimately there will be exudation of a plasma as well as fibrin, which is present into the plasma, right? So ultimately what happens, this fibrin will be come out from the circulation. It will get deposited over the surface of nasal epithelium. In that case, uh, you will find such type of typical fibrinous rhinitis. Okay, so this fibrin accumulate on the surface, it will form typical membrane, and many a time they are also known as pseudomembrane. They are also known as pseudomembrane because this entire fibrins will be get deposited over the surface of epithelium, and in that case we will use the word pseudomembrane. Okay, so depending upon the how this pseudomembrane is actually adhere to the mucosa, depending upon that we will use the word either pseudodiphtheric rhinitis or diphtheric rhinitis. Okay, so in case of pseudodiphtheric rhinitis, what happen? The fibrinous exudate actually easily removed from the underlying mucosa. Right? If you try to peel off this fibrin capsule, this fibrinous exudate, in that case, what happens? Fibrinous exudate can easily be removed from the underlying mucosa. In that case, we will use the word pseudodiphtheric rhinitis. While in case of diphtheric rhinitis, what happens? The there will be deposition of a fibrin over the mucosa, but underlying mucosa is actually also get damaged. They are also get necrotic. So ultimately, what happens? The necrotic cells as well as fibrin, they both get mixed with each other, and ultimately, if you want to separate this fibrin from the underlying mucosa, then it is not possible. Entire mucosa as well as fibrin both will actually come off, so you will find ulcerated area, right? So this is known as this is known as diphtheric or fibrinonecrotic rhinitis, right? So what is the difference between the pseudodiphtheric and diphtheric rhinitis? In case of pseudodiphtheric rhinitis, fibrin layer can be easily removed, underlying mucosa is comparatively healthy, right? But in case of diphtheric rhinitis, there will be necrosis of the mucosa, and these necrotic cells will mix with the fibrin, and they will firmly adhere to the mucosa, underlying mucosa. So if you want to peel off this fibrin, then ultimately what happen, along with the fibrin, underlying mucosa will also come off and you will find ulcerated surface, right? So this is known as diphtheric membrane. Okay. Then granulomatous rhinitis, name itself indicate when you will use the word granulomatous rhinitis, when there is infiltration of a macrophages, right? So whenever there is infiltration of macrophages, in that case we can use the word granulomatous rhinitis. So granulomatous rhinitis is quite common in chronic allergic inflammation as well as some typical infections like fungi, tuberculosis, and rhinosporidiosis. Right. So rhinosporidiosis is actually quite common in human as well as in animals. Okay. So here you can see this is a picture of a nasal cavity. The actual nasal septum, which is normally present here, is actually removed. Here you can see these are the teeth, and this entire nasal mucosa. Here you can see this is actually this. They are become reddish as well as they have contained some exudate over the surface. Okay, so this all white material is actually exudate, and if you see the mucosa, they become slightly hyperemic. Right, so this is known as suppurative rhinitis. This is actually suppurative exudate, right? So they are known as suppurative rhinitis. Here you can see this is one side of nasal cavity, this is another side of nasal cavity, right? So here what happened? This particular lesion is actually unilateral. They affect only one side of the nasal cavity, and this entire nasal cavity is filled with the exudate, right? This entire nasal cavity is filled with the exudate. Here also this is suppurative rhinitis. And here you can see these are the nasal terminates, right? These are the nasal terminates, and these are the actually airway, right? Air actually traveling from this particular space. Here you can see this is nasal cavity. Air will enter from this space, and this particular nasal cavity is actually filled with the exudate, right? So this entire nasal cavity is actually filled with the exudate. So this is fibrinous rhinitis. Okay, this all are actually fibrin mixed exudate. Here you can see this is dog. Okay, and this particular nostril is filled with the mass. Okay, and this particular mass is due to Rhinosporidium sebae. This is actually one typical pathogens. Okay, recently classified, and they are responsible for production of a typical granulomatous rhinitis. Okay, then second infection, the second condition is progressive ethmoidal hematoma. Progressive ethmoidal hematoma. So this progressive ethmoidal hematoma is actually seen in some older horse. This clinically characterized by chronic, progressive, often unilateral nasal bleeding. Okay, so here what happen? You will find nasal bloody discharge or blood which is oozed out from one side of the nostrils, and if you examine grossly or by endoscopically, then what happen? Particularly, you will find hematoma in ethmoid terminates and surrounding areas, right? So ethmoidal hematoma are actually seen, and this hematoma will be appeared as a single soft tumor-like or occasionally pedunculated mass which can occupy entire nasal cavity, or sometime each actually displays some of the terminates. Here you can see this is a typical presentation of a progressive ethmoidal hematoma, right? Here you can see this is nasal cavity, and from this nasal cavity, when if you reach into the ethmoid terminates area, here you can see this all black area are nothing but they are actually bloods are get accumulated. They are actually hematoma. They are hematoma. Okay, so they are most commonly seen in this ethmoidal terminates, near the ethmoidal terminates. So they are known as ethmoidal hematoma. Now pathology